We're here at Hawkesbury Dentistry this afternoon to have a chat with Dr. Steve Cross and have a look at some cases from his KaVo OP3D Pro Cone Beam CT. Steve, what do you got?
Well, there's an interesting case here. A patient was referred to us because she'd had an attempted extraction of a difficult 4/8, and the operator only had an OPG, and the operator was concerned about the proximity to Ian, and she was happy with us to take a 3D image, and then we're going to proceed to get this tooth out for this lady. So if you come over here short, it's pretty interesting, this case. The lady, this lady needed 1/8, 3/8 and 4/8 out, and the other operator started on 4/8, and you can see here it's broken off, and the proximity to the nerve made the operator a bit concerned about it. So we've got a 3D picture, and I'll bring the slice forward for you to see. And you can see this is the lingual side, this is the buccal side. The tooth fairly well pressed onto that lingual plate, and knowing that now, when we do this surgery coming up, we're designing a distal wedge here on the superior part of the root, and we're going to very, very carefully split these roots and take them out. But I can move up and down those roots with confidence where we are. I'm just going towards the apex of the tooth now, and even though it's fairly close to Ian, I know exactly where I am. I can actually take measurements. And whilst we're here, we're going to take out 1/8 as well, because it's decayed. Coming across, straight across to this 3/8.
Wow.
And we're doing this in theatre. And I like this technique where I can measure easily. I'll just make this a bit larger, Sean, and I can measure easily exactly where I am. I'm just going to my little measuring tool here and measure down from the bottom of the tooth. And so I know exactly where I am along the length, how far away I am from the nerve. And that gives me great confidence in setting the stop on the drills, how far I go down to section this tooth. So I'll do a distal wedge on here, section this tooth into probably 3 or 4 bits. And the other little interesting thing, see how the tooth sort of shortens here. If you bring the slice along to the end, in the cross-sectional view, the suspicion there's a hook on the end of that root is correlated with this image here, and it swings around at the very end and touches the top of the nerve. So hopefully by the time I get down here, this will just gently tease out and have a successful result there.
So, attempting wisdom tooth cases without this system, would you be contemplating that?
I would not have contemplated this without a detailed cone beam. Since I've had this machine, I found a lot more confidence in the things I do, and they're more involved things. And it doesn't matter what level you are or what particular aspect of general dentistry you're interested in, this will improve your ability to approach any of those things, I'd say by 30–40%. Yeah.
Wonderful.
I wouldn't dream of touching this thing from an OPG, no.
Yeah. Thanks, Steve.
Okay, pleasure.